This is section 6. It continues on with treatments for psychological disorders. We're going to look at behavior therapy and cognitive behavior therapy. Behavior therapies view psychological problems as learned behaviors that can be changed without searching for hidden or unconscious causes. Therapists help clients to understand the learning principles that maintain their problems and then teach them to learn more adaptive behaviors. Features of this therapy include a good therapist-client relationship, a careful listing of behaviors and thoughts to be changed, a therapist who acts as a kind of teacher by providing learning-based treatments, and a constant evaluation of the therapy's effects. Methods that rely mainly on classical conditioning are called behavior therapy. Those that rely mainly on operant conditioning are called behavior modification, and those that focus on altering both thoughts and behavior are called cognitive behavior therapy. Some techniques for modifying behavior. First, we have systematic desensitization. During systematic desensitization therapy, a client practices progressive relaxation while imagining fear-provoking situations from a desensitization hierarchy or a list of fear-provoking situations. The process of remaining calm while thinking about something feared weakens the learned association between anxiety and the feared object or situation. In vivo or real-life desensitizations appear to be especially effective, but were difficult to arrange or control. A new technique, virtual reality graded exposure, makes it possible for clients to experience precisely graduated versions of the feared situations without actually being exposed to them. Our second technique is modeling. In modeling, a client learns skills by watching other people perform desired behaviors. In participant modeling, the therapist demonstrates desirable behaviors and the client practices them. The clients can learn to be more appropriately self-expressive and comfortable in social situations through assertiveness training and social skills training. Third technique is positive reinforcement. A therapist systematically uses positive reinforcement to alter problematic behaviors. They set up contingencies or rules that specify the behaviors to be strengthened through reinforcement. The receipt of rewards or tokens is dependent on a client's display of desirable behaviors. In institutions, behavior therapists sometimes establish a token economy program or a system for rewarding desirable behaviors. Number 4 is extinction. To lessen a behavior, extinction is used. Reinforcers that normally follow a particular response are removed. An exposure technique called flooding, which extinguishes a conditioned fear response, keeps the patient in a feared but harmless situation. As a result, the client who is deprived of the normally rewarding escape pattern learns that there is no reason for the continued anxiety and the fear response gradually weakens. In a related method called implosive therapy, the therapist helps the client to vividly imagine being in the feared situation by describing it at length and in great detail. Number 5 is aversion therapy. Aversion conditioning uses classical conditioning to reduce undesirable behavior by associating it with some psychological or physical discomfort. Aversion conditioning is unpleasant, does not work for everyone, and its effects are often temporary. Therefore, it's not used often and only long enough to allow the client to learn alternate behaviors. And the last one is punishment. To eliminate a dangerous or disruptive behavior, punishment may be used. An unpleasant stimulus is presented after the behavior, which reduces its occurrence. Moving into cognitive behavior therapy, this therapy relies on learning principles to help clients change the way they think as well as how they behave. And there's two that we'll look at: rational emotive behavior therapy, or REBT, and Beck's cognitive therapy. Rational emotive behavior therapy, or REBT, was developed by Albert Ellis. REBT aims at identifying and replacing unrealistic, self-defeating, problem-causing thoughts. In cognitive restructuring, one replaces upsetting, irrational thoughts with alternative, adaptive thoughts. In stress inoculation training, the client imagines being in a stressful situation, then practices newly learned cognitive skills to remain calm. Aaron Beck's cognitive therapy is based on the idea that certain mental disorders can often be traced to errors in logic and false beliefs, or cognitive distortions. The therapist first helps clients to learn to identify the cognitive distortions that precede anxiety, depression, and other psychological problems. Then they subject these thoughts to critical thinking and hypothesis testing, providing concrete evidence that challenges and ultimately destroys erroneous beliefs. And our last section is group, family, and couples therapy. First one, group psychotherapy. In group psychotherapy, several clients interact under the guidance of a therapist. Clients often feel less alone in their problems and can boost one another's self-confidence and self-acceptance. Clients share and learn from one another and can try out new skills in a supportive situation. And family and couples therapy. Family therapy treats two or more people from the same family system. The problems of one family member make her or him the initially identified client. However, the family becomes the client, and the goal is to create harmony and balance within the family by helping each member understand family interaction patterns and the problems they create. And finally, couples therapy, improving communication between the partners is the focus of the treatment. And that is it for section 6.